And on that note, tonight, New York's Governor Andrew Cuomo says hospitalizations in the state went up 40%. New York has nearly half of all the coronavirus infections here in the U.S. 911 operators in New York City say they're on pace to receive as many 7,000 calls just today. A hospital in the borough of Queens is now at the center of the crisis, and Mola Lenghi is there. Mola?
Well, Nora, in just 24 hours in New York City, 100 people have died due to the virus. Across the state, 1,200 people are currently in ICU. Medical staff, from doctors to nurses to EMTs, they're struggling to keep up with the influx of patients, and nowhere is that illustrated more than this hospital here.
Today, the crush of patients at Elmhurst Hospital was so overwhelming that 50 additional workers were sent there to help. Some of the sick are being transported elsewhere. This after 13 people died in just 24 hours at Elmhurst. EMT worker Anthony Almojera.
From the perspective of being properly prepared, the training is there, the equipment is not.
They all have COVID.
This doctor's video posted by the New York Times illustrates the bleak picture.
I don't really care if I get in trouble for speaking to the media. I want people to know that this is bad. People are dying. We don't have the tools that we need in the emergency department and in the hospital to take care of them.
Makeshift morgues are being set up at city hospitals. Across the country, more than 1,000 have already died. A review by the Washington Post found that 65% were over 70 years old and 60% were men. In Michigan, this emergency nurse sounded the alarm.
I didn't choose nursing or the healthcare field to not help people, and that's exactly what the choices are that they're giving us. They're giving us no choice but to help only the people that they think that can survive.
But the sick keep coming. In Chicago, a blunt warning from the city's mayor.
We could be expecting upwards of 40,000 hospitalizations in the coming weeks.
In Miami, more than a dozen crew members were escorted off this cruise ship by people wearing protective gear. Back in New York, healthcare workers are continuing to express their concerns over worsening conditions.
We are on the front lines of this, doing it to the point of exhaustion. We're going to run out of these masks unless we get some type of emergency supply.
Well, testing here at Elmhurst Hospital will continue in the tents that you see behind me there. That'll pick back up tomorrow morning. But that concern that you heard in that EMT's voice, that's real. Their union tells us that 400 of their uniformed members have been diagnosed with COVID-19. That is 10% of their workforce, Nora.
Mola, thank you.